The Go Red for Women Luncheon was held at the Abilene Convention Center today to educate the public about the leading cause of death in women.
According to the American Heart Association, cardiovascular disease causes 1 in 3 deaths every year. KRBC's Catherine Garcia has a few important numbers to remember for your own heart health.
Just a little. Good luck.
Janet Bryce says her family's heart problems have always been a concern for her.
In my family, between 40 and 55, many have died with one heart attack.
Knowing her family's history, she's continued to monitor her own health.
Cholesterol's always been high, and take medication for it, it's still high.
Fran Smith of the American Heart Association says properly treating women for heart-related problems has been a chronic issue in healthcare.
Several years ago, a woman would go even to the ER or to their doctor, and they wouldn't realize what their symptoms were. I mean, even the physicians, they would send them back home and they're having a heart attack. So women are dying from heart disease.
Hendrick Cardiovascular Care says you should be checking your numbers, and those numbers include your blood pressure, cholesterol, and blood sugar. Now, the ideal blood pressure is 120/80. Your total cholesterol is recommended at less than 200, and your blood sugar should ideally be less than 100. Now, again, 120/80 is the ideal blood pressure, less than 200 is the ideal cholesterol, and your blood sugar should ideally be less than 100. You should also check those numbers with your physician. In addition to monitoring your numbers, Marty Tebow of Hendrick Medical Center says it's never too early to start exercising or improving your diet.
Cardiovascular disease usually develops over years, so plaque in the arteries takes years to develop. So if we can work on it when we're young, we can significantly reduce our risk.
In Abilene, Catherine Garcia, KRBC, Abilene's local news.